I'm Morgan Sweere. I'm an ER doctor. I live in Jacksonville, Florida. I obviously, there's not a lot of girls in racing, so I get it, whenever it's like a random blonde girl just gets up here and wants to talk about racing, it's like, what do you know about this? But my background, I'll talk about here in a little bit, but just briefly, I'm an ER doc in Jacksonville, Florida. I work at Volusia. I've worked there for about a year and a half, I guess, and I grew up around racing, and next year I'll be a motorsports medicine fellow at Indianapolis Motor Speedway over there with Patrick. I got a little disclosure about this presentation. I emailed Brian whenever I saw about the safety summit, and I was like, I'd love to get involved, and I'm really passionate about this. What can I do? And he was like, I'd love for you to give a presentation about head injuries. So my disclosure is this: I am a resident physician. That means that I have an MD, but I'm still finishing my training. I got 5 months left, and then I'll be a full-fledged ED doc. I'm not a sports neurologist, so I'm not the end-all be-all expert for head injuries, certainly, but I've seen probably at this point in my career thousands of head injuries from mild to severe, so I have seen a lot of this. I see this stuff all the time. So I did grow up at a racetrack. I am a pit crew princess, I suppose, but I grew up watching my dad race dwarf cars and now modifieds. After medical school, I did a month of training at Indianapolis Motor Speedway, following them in the safety truck and in the pits, learning about driver extrication and fire safety and all these kinds of things, and now working down there at Volusia. So just to kind of set the scene a little bit and bring it back, I think he did a great job up here talking about his injuries as well. The first memory that I have watching my dad at the racetrack is when I was 4 years old, watching him catch on fire. This is an early and very old and very crappy picture of that wreck. But I just remember standing in the stands holding my grandpa's hand and being like, completely helpless. That's not a great feeling for any loved one to have. That's why I became an ED doc, because I don't like to feel helpless. I want to know what I can do. I just remember waiting for him to get out of the car, and luckily he did not have terrible burns, but I think everybody that's been involved in racing has certainly seen an abundance of wrecks, if not terrible ones. At the track that I work at, Volusia, we've got this sign that stands up there. It says, somewhere at this track, there's a little kid who wants to be just like you someday. You owe it to them to be the best that you can be. And I think they put that up there because they don't want people out there on the track fighting. They don't want anybody flipping the bird to the flag stand guy. But I think I look at it a little bit differently. I think we owe it to everyone to be the best that we can be from a safety standpoint as well. We had a guy this season who won, and he's crossing and going into turn one, and he sticks his hand out the window, and it's a bare hand. And I'm going, man, no, that ain't it. You didn't have time to take that glove off. You weren't wearing it. And I think, it's one thing to see that, or to hear, oh, it's just hot laps. We don't have to be completely 100% have everything right. Or, we can loosen things up, or, do this or that. I think we owe it to everybody to make a better impression on the next generation of racers and to do a little better from the safety standpoint. So main thing I'm talking about today is concussions. What is a concussion? There's 1,000 definitions for what a concussion is. They range from very simple to very complex. But head injury essentially exists on a spectrum. You'll see very severe head injuries where you get like diffuse injury, seizures, death, and then very mild traumatic brain injuries. That's what a concussion is. It's a very mild TBI, essentially. And so while that looks like essentially something that sometimes it's like, oh, well, that's not that bad, you can get back out there, that can still have permanent damage to the brain, and it adds up over time. We've seen that a lot from the football standpoint of all the research that they're doing. So essentially, concussions are a clinical diagnosis. I can't run you through a scanner, do all these things and say, oh, well, you don't have a head bleed or a skull fracture, you have a concussion. I have to look at the patient, at the driver and say, oh, well, these are the symptoms he's having, this is what I'm seeing, and that's how I know that he has a concussion. So what kind of stuff are we going to be seeing? This presentation is geared really towards safety from a dirt track standpoint. I think I got amazing training, at Indianapolis, but that's the mecca of safety. They got all the money, they got all the gadgets, and we don't have that. We're standing out there on a track and they're saying, well, we have this much time till we get these other 2 cars towed. We need to figure out if this guy can go or not. And we got to get back on TV, blah, blah, blah. So that's kind of the standpoint that I'm looking at it from. So I want people to be able to recognize these things. I also want drivers that are looking at this saying, I want them to know what they should be looking for in themselves, and I'll talk about kind of why a little bit later. But basically, not everyone that has a concussion passes out. I think that's a big misconception. You think, oh, you hit your head really hard, you passed out. That's the main way I know you had a concussion. Some people will have that, some people will not. A lot of people will have other symptoms. They'll have blurry vision, they won't be able to walk right, they'll be kind of forgetful, they won't be able to concentrate. They may just have a persistent headache. That's the most forgotten symptom that I see for concussions, is a persistent headache. And I'm talking about like hours later, not like you got out of the car, you're still sweaty, and you went to your truck to get water and you still have a headache. I'm talking about you're at home, you're next morning, and you still have a headache. That's a concussion, 100%. So when we talk about head injuries in racing, there's a lot of very prominent head injuries, obviously, like these couple up here, I bet everyone in the room probably knows. When we're talking about motorsports, we're talking about a very high-risk population. So a lot of the studies that are done in racing are done at the high levels with a lot of money. We're talking about F1, NASCAR, IndyCar. There's not very many studies for dirt track racing. So how do we know how many people are having head injuries in racing? How do we know how many people are having wrecks in dirt track racing? How many dirt track racing wrecks are there per year? No one can tell me, because there's no records, because there's no research, because there's no money, and here we are. And that's why I'm here, because I care about that stuff. So we estimate, basically, I listened to a study where they kind of estimated what they thought may be the amount of racing that we have in dirt track. And they estimated that it's about 70 times the number of wrecks that NASCAR has. So that's a lot of wrecks. And I think, it's easy to see, the levels of racing like that are highly televised on ESPN and say, oh, like no one gets hurt in racing anymore. A ton of people get hurt in racing. It's just, we don't have any records of it. Whenever we have studies about racing, this quote comes from one that was done actually in the UK. They don't have a ton of dirt track there. They have a lot of like rally and lower like F2 and stuff like that. But they were looking at head injury attitudes, basically, about drivers, team members, things like that, saying that basically 45% of drivers had suffered a concussive episode. Only 50% of those people saw a doctor. Less than a third withdrew voluntarily from the event. 70% did not feel normal when they attempted to return to the race. So we don't know exactly how many people are having concussions and head injuries in racing, but I'd wager it's a lot more than we think it is. And not very many of these people are completely back to normal whenever they're going back out to race, which is a huge issue. So what data do we have on dirt track racing? There's being more studies done on it, and there's some research that's coming out that's very, very well done, that's studying essentially how the head moves in the car, looking at mouthpiece sensors and other sensors that go on the seat, essentially, like right here, because that's the closest thing you got pretty much to model the head, and looking at the different forces that we have. You can think about the brain essentially kind of like a snow globe. So whenever you're moving in the car, you can shake up a snow globe like this. You can shake it up and down. You can swirl it around. And all of those movements will make the snow go up and down in all kinds of ways. Every movement affects it differently. And when you have a crash, you're not just having probably just head on. There's head on, there's some kind of sideways, there may be some kind of flip, you're kind of up in the turn, there's other kinds of impacts that are going on with it. Essentially, other studies that have been done are looking at spinal injuries in racing, but overall, there's really not any like concrete, this is what we are seeing in dirt track racing from a head injury standpoint. The research is just not there. It's not there right now. And we're making progress, and the things that we're seeing are very, very interesting. One of the studies that I listened to be talked about at another conference this year was about a study that they did in the USAC Midget series, where they modeled some kinds of the wrecks that they had and used the sensors to tell what was going on, and they had quite a bit of force going on right there. It's kind of like the forces that we're seeing, essentially why people get head injuries in racing. We have a lot of different forces that you don't see in other sports. So if you ever see like a midget wreck, they kind of bounce. They do this like bounce thing that you don't really see in every series. Like I've never seen a late model particularly bounce like that. And you don't get that kind of vertical energy on top of the head in many other sports where you have like kind of top-down type of force. Essentially, whenever you have like a rapid deceleration, when you crash and you stop, your whole body goes forward like this, and then it kind of goes back. And that big force on the bottom of your skull, the basilar skull and your neck, when you're going back after stopping, that's a huge reason that you'll see a lot of basilar skull injuries and skull fractures and spinal cord injuries in the neck from racing, is from that rapid stop. It's like, I can't remember who said that, some famous, it might have been Andretti that said the danger in racing is not in the going, it's all in the stopping. But that's pretty much the research that we have in racing so far. It's very little. So we talked a lot today about what determines why people get hurt in racing, the vehicle design, the track conditions, speed, the impact forces that I talked about, the safety equipment, and then there's individual factors. Like if your driver had a concussion yesterday and they get hit again today, that's going to be a lot worse than if they had never had one before. So if we can't use research from racing, what can we use? We can try and use research from other sports in the NFL. My hope, and what I think will probably end up happening in racing, is it's going to be kind of similar to the history of head injuries in the NFL. No one talked about it for a really long time. And then all of a sudden it just blew open and everybody was like, oh, we finally got to talk about this. There's so many issues. We got to do all this research and all this stuff. And I think that's probably what's going to happen in racing. I don't want it to be that enough people have to get hurt for us to do a whole bunch of stuff about it. I want us to do a whole bunch of stuff about it so nobody has to get hurt. So what can we learn from the NFL? They use a lot of video review of the impacts. A lot of our races are videoed. We can use a lot of video review to look at races and say, okay, what kind of impact, what kind of injury might we suspect that they have? In the NFL, they use the most specific sign to learn if a patient has a head injury if they're slow to get up. I've seen that. I think you'll all see it. You see somebody, they're kind of, dazed in the car. You go up to them and you say, okay, can you undo your seatbelt? And they're just kind of sitting there looking at you. That's a sign that they might have a head injury. They can't they can't take their seatbelt off, take their steering wheel off, and get out of the car by themselves. That's a big sign that they have a head injury. In the NFL, it's very interesting. 40% of concussion evaluations are self-triggered by the players. So we talk a lot in racing about people, they want to go back out to race, and I think that's true. I think, in the NFL, probably equally true. A lot of money on the line in both sports. And I think, looking at things, we got to give our drivers the information to be able to know when something's wrong so that they themselves can also report these things. Because if they're self-reporting these symptoms, then our drivers can self-report their symptoms as well. People say that they might want to hide their injuries because they want to get back out on the track. Nobody wants to get hurt. Nobody wants to be done from racing forever. And I think, people will report things to us. They say that the most common symptoms that led to they had yes to the answers, had concussions, were headache, pressure in the head, and don't feel right. So earlier that study said that 70% didn't feel right when they went back out to race. How many of those people had concussions? So what's currently what we're doing in racing to evaluate for head injuries? So when I look at this, I'm talking about all of the options. This is a lot of these things I've seen being done in NASCAR and IndyCar. As far as these things, this is the current options, the best of what we've got right now. They're using oculography a lot. So whenever you have a head injury, a lot of the things that cause you not to be able to walk right or being dizzy or those kinds of things are issues with actually your eyes and rapid eye movements and things like that we can't really see with the naked eye. And so they use these small movements, they use these goggles to essentially test for these things and to determine if they have a head injury. There's also a ton of tests that you can use. You can ask somebody 1,000 questions, make them walk 1,000 lines, do full neuro exams, and yeah, you'll figure out if they have a head injury. But we can't really do that out on a dirt track in 2 minutes. So how are we going to figure out if you have a head injury and you can go back out to race if your car's not messed up? So there's no rapid, accurate tool to diagnose a concussion with validated research. It's a huge issue. So what are we going to do? There's no definitive trackside test for concussion detection, and that's why it's dangerous. This is kind of what I do, basically. This is not validated by research. If I could go out there and do a full neuro exam on every single person, that would be really boring for everyone who's at the race to watch, but I'd be able to figure out if they have a head injury, probably. This is what I do, essentially, to go to the track and say, okay, I have no resources. I can't get oculography goggles. We don't have all that kind of money and time. This is what we have to do to try and see if this guy has a head injury. I called it the 7 T's to try to make it memorable for everybody. Number 1, take the helmet from them. Look at their helmet. I think it was said a little bit earlier, if you got a $10 head, use a $10 helmet. None of y'all have $10 heads. I don't think your mamas would say that. Everybody needs a nice helmet, but what can we look at on the helmet to determine if they have a head injury? You can essentially percuss it. Like when you're looking for a stud, you'll kind of knock around and you'll see that it sounds different in one place. You'll see that on the helmet, and you'll be able to tell that it's essentially deformed in one way or another. I mean, if it's obviously deformed, then it's pretty obvious. But if it's not, then you can kind of knock around and tell. Tell me what happened. What am I doing when I'm asking them this? So I'm asking them, it's kind of a 2-step question. So I want them to be able to tell me, where we're at. We're maybe on this lap, we're maybe on this turn. This is kind of what happened. If they can't remember what happened, that's a red flag to me. If they can't tell me, like, we're at the racetrack right now, that's even a bigger red flag to me. That's it right there. Tell me where you're hurting. So it's easy to walk up to the car and say, you hurt? And they're like, nah, and it's, okay, let's move on. That doesn't tell us anything. So tell me where you are hurting, because then they have to process in their head, I am hurting. Now, second step, where am I hurting? And they have to be able to answer that question for me. 4, I asked them to do a 2-step command. So it's hard because it's loud all the time. So it's very tempting to go like this and be like, take off the steering wheel and put it right there. But I want them to be able to process what I'm asking them to do and do it. So I asked them to take off the steering wheel and put it to the right or something of that nature. And that tells me if they're understanding what I said and able to process that into an action and coordinated enough to do it. So these things are small steps, but they're actually getting me a lot of information about someone's neurological status. 5 is track walk. Essentially what I'd say for this is you get out of the car, you walk from here to the safety side by side or whatever you have, here to there. If you can't walk, you can't get yourself out of the car and walk, you cannot get back in the car at all. 6, tenderness to the neck. Why do I care about that? So we talked about earlier that rapid deceleration causes a lot of pressure on the basilar skull. A lot of times, if you have a head injury, you have an associated cervical spine injury. So I want to know if the middle of their neck hurts. Sometimes it'll be on the side. I want to know right here over your spine, does it hurt? Does it hurt at all? And that can help us because a lot of the times lower head injuries are confused with neck injuries and upper neck injuries are confused with lower head injuries because they go right connected together, overlay each other. 7, take their word. I think that's the hardest one to do because I feel like I was also always taught, everybody lies about their symptoms. They don't want to be in the hospital. Everybody wants to, play sports, whatever. But the literature for the NFL says they will tell you. And the literature in racing even says, people know when they don't feel normal. If they don't feel normal, they're just say something's off and they can't tell me what it is. That's enough for me to say, let's sit it out for a sec and figure out what's going on. So if their car's so messed up that they can't get back in the race, that's one thing. It's like, all right, cool. I need to know if you have a head injury, but it's not as immediate of on the track evaluation. If their car's not destroyed and they can go back out, then I need to know if they are safe to go back out. Essentially, these are the things that I would say, no, you cannot go back out. LOC, what that means is loss of consciousness. If they pass out, they cannot go back out. If they're amnestic to the event, they don't remember what happened. Ataxic, that means they can't walk straight. If they can't walk normally without any assistance, they cannot get back in the car. Any of the 7 T's I talked about on the last page are abnormal, I'd consider not letting them go back out. And then also, it's kind of up to your discretion. When you see a hit, you're like, ooh, that was bad. If you're concerned about the hit, just keep them out. That's me being on the safe side of things. And yeah, it's probably fuddy-dud to keep some people out because you thought their wreck was bad, but out of one race, permanently injured and unable to race for the rest of your life or dead, I'll take my odds on that one. So what do I do once I think they have a head injury, essentially? Send them home with a caregiver. These people got to the race somehow. If they have a head injury, they can't drive themselves home. If I don't think they can get in a race car, I don't want them out on the interstate either. That means that someone else needs to drive them in their race car home. It's our responsibility as safety personnel to make sure that they have a safe disposition home. They need to follow up with a physician. I think a lot of people that I've talked to at the racetrack, at least, that I say, hey, I think you should, go to the hospital. That's only been 1 or 2, but they seem unlikely to go. But I think also one thing that I would love to see from a safety personnel standpoint is us following up the next day. That's what they do in IndyCar is someone from the medical team will call them the next day and say, hey man, it's Morgan from Volusia. You hurting today? What's going on? You feeling all right? And I think that simple thing, fosters a culture of safety in racing that we really need. And I think it's also one of those things that's like, if something is wrong, they may not have had the motivation to go all the way to the doctor, but from that phone call, it's like, okay, well, something is wrong. Let's do something about it. And you can get them there from that point. If they have a concussion, they need cognitive rest. They need to limit their screen time, music, loud noise, get adequate rest. And then one of the big ones that we see issue with is kind of that return to play type of issue or repeat head injuries. So if you get a head injury and then you have another head injury within 7 days, you can get something that's called second impact syndrome. And essentially what that is a worsened head injury. They kind of build on each other. And you can have significant impacts leading up to permanent brain damage and death from second impact syndrome. I'm not saying if you get 2 concussions, that's what's going on at all, but they do both build on each other. It's not something that we want to do. So if you're in, some kind of thing where it's like multiple race days in a row and someone has a head injury, I'd consider not letting them race the rest of the weekend. So in summary, what I wanted us to learn today are that concussions are really hard to diagnose. There's a lot of specific testing that you have to do and things like that. You can't see it on imaging. It's even harder to diagnose that on a racetrack. There's not enough research in dirt track racing. This field is wide open. There's a ton we could do. I would consider the 7Ts as part of your on-track assessment. This is kind of just what I do because I can't do a full neuro exam out there. Like I said, it's not research validated, but this is something that I would consider to get you enough information that you'd feel comfortable saying, I'd feel okay with them going back out on the track. And then make sure anyone with a suspected head injury is instructed on follow-up care. So I think what I got next, so y'all let me up here, so now I have a microphone and y'all have to listen. So this is what I really care about this stuff a lot. This is basically my Christmas list for dirt track racing, what I'd really love to see. Standardized safety equipment and response across tracks. Training for all track staff and drivers on safety. And this 3 is my number 1. So I say this is my Christmas list. This is really my career ambition list. So y'all can check back in 20 or 30 years and see where I'm at on things if all this stuff is done. But I really want us to have an incident collection database for dirt track racing. How are we going to know what injuries people are having and how often if we don't even know how many wrecks there are? That's like next couple of years, this is like what I'm currently working on. I think we've got to face it from an incident classification standpoint, because I think from a liability standpoint, no one's going to report wrecks and injuries, but they may report incidents like class 1 incident, stopped but kept going, or stopped and needed a push. No one wrecked, no one got hurt, but that's an incident. But then they may be more likely to report a level 5 rollover or something like that, multi-car incident. So that's kind of how I'm looking at it, but I think that's number 1 because we can't really do anything until we know what are able to quantify the issue. Physician trained in motorsports medicine at every racing event. I know, that's a tall order, but I would love that. I think that's something that everyone could benefit from. And we have docs at high school football events all the time nowadays, and so I don't think it's that wild in 2025. Incident analysis monitors on every dirt track race car. I think if we could see the video of the race and we could get the numbers on what's happening, we could predict injuries and do a lot of good with it. And then research on dirt track racing, series-specific risks and injuries and incident data collection, and then everybody to go home safe. That's pretty much what I want. If anybody has any answers to those things or any information, I will take your advice and ideas. This is pretty much the end of it. I've got my information up there, and that's pretty much it. I'll take any questions that anyone has too. I kind of rolled through things pretty fast, but I just wanted to kind of give an overview of everything.